Actually, no, I'll leave that in there. That's fine. Next slide. You'll see it was at this point where I realized that I forgot to do the intro. Yeah. Malignant melanoma is an autosomal disorder. Both parents have to have the gene in order to pass it to the child. It is recessive, so they both have to have it. Again, the disorder is when you have a lack of chromosomes, not extra, not damaged ones. It occurs on the CDKN2A gene on chromosome 9, linked in CBI. The disorder occurs in that gene, yeah. These are two different kinds of melanoma, what the genes look like when you have it. These look very different. This is how it normally looks. That's the website. What? What is it? Yeah, this is the website. Okay. There's about a 0.00068% chance that you'll be born with malignant melanoma in 1997 at least. In 2018, it is estimated that there will be 91,270 new cases of melanoma in the United States, and about 9,320 deaths from the disease. Holy heck, man, that's a lot. About Control-C, Control-V percentage of people will be diagnosed with it in the world. It doesn't sound that high, but that's because there are 7.5 billion people in the world. People are most susceptible to getting malignant melanoma if they have lightly pigmented skin. These are the sites I used to find this stuff. The sites I used for this one, signs. What does it do to the body? It can be seen as a sudden mole appearing or a change in skin growth. It can be almost any place in the body since it's just a spot. It can show up as a spot on your body. It's the most aggressive kind of skin cancer, which obviously means it can cause death. It can affect almost the whole body, including the brain, your lungs, your intestines, and your liver. Symptoms. Hardened lumps under your skin can appear, like this weird looking brown thing right here. Swollen or painful lymph nodes, trouble... Dang it, I cannot say this. Swollen or painful lymph nodes, trouble breathing, or a cough that doesn't go away. Image of person with disorder. Oh yeah, this is their skin. URL, this is the website that, yeah, I'm not going to go into that again. Okay, quality of life. Wait, no, crap. Image of how disorder affects body internal organs. That's what it looks like. That's what it looks like. That's, yeah, okay. Quality of life. It can be difficult for patients to move around more than most people because of bone pain. Their quality of life may be affected because they have trouble breathing, and if they know they have malignant melanoma, they may be worried about themselves surviving, so they could be stressed about that, and they might not be as happy, or, some limitations are that the person might not be able to jog or run, or lift heavy things due to their bones hurting. The life expectancy of a patient is about 2 to 7 months. The estimated 5-year survival rate for patients whose melanoma is detected early is about 99% in the U.S. The survival rate falls to 63% when the disease reaches the lymph nodes, and 20% when the disease... Why is it being so laggy? What is it doing? Okay. There we go. What was I? Is the lymph nodes, and 20% when the disease... This word. To distant organs.
It's pronounced metastasizes.
These are the sites that can help people cope with this disorder. I think it's doing it again. There you go. This is the diagnosis and how you detect it. A person can be diagnosed with it if you just look at their skin, and if like a color has spread from, like, if it goes past the actual area where the mole is, like if it goes into surrounding skin, then that's a sign. Tests used to diagnose the disorder are a skin observation, or a biopsy, aka a punch biopsy, where they take out a small piece of your skin and then you examine it with a microscope. If you're at risk, you should get checked once a year. If you don't have any moles or random colored pieces of skin, then that's good, I guess. If you do, then that's fine, but check to see that they all look normal. And one of the side effects of it, or symptoms of it, is that your sores don't heal that fast or at all. So if they do heal, then that's good. This is the site where I got that all from. Treatments and cures. There are treatments for ligma, but you can do surgery on a grape. There are treatments for malignant melanoma. You can get surgery to remove it from your body if you recognize it in an early enough stage. Chemotherapy drugs are used to treat melanoma, but it's usually as a last choice because it doesn't work as well as it does in other types of cancer. There are no non-medical ways to get rid of malignant melanoma, and I mean, if you count surgery as a medical way, then there are no non-medical ways. Yeah, I just realized like how stupid that sounds, because surgery isn't medical, so yeah. If you recognize it early enough, you can get treated, but not completely cured from it, because you might have a chance of it returning many years later if you already had it. And it doesn't leave behind scars, paralysis, or brain damage. Genetic counseling. This thing feels so unresponsive sometimes. Genetic counseling. The disorder occurs in the CDKN2A gene. The gene is located on chromosome 9. This is the website that I got that from. A genetic counselor would say that if both parents have it, they have a 50% chance of passing it on to their child, and a 50% chance of having a normal child because, well, they have a 25% chance of, wait, no, let me think about this. They have, if both parents are carriers, then there's half a chance. Okay, so yeah, they have a 50% chance of a child who's completely, like, is active on them. And then they have a 25% chance of having a normal child that's also a carrier. Then they have another 25% chance of having a completely normal child that isn't a carrier. This is the pedigree chart for it, and this is the site I got that from. This is the current research and case study for it. The last time melanoma research was approved by the Cancer.net editorial board was in June of 2017, more than a year ago, unfortunately, so it's not super recent, but they're doing research and experiments with enhanced prevention and early detection methods, targeted therapy, immunotherapy, vaccines, palliative care, and more. Palliative, is that how you say it? Here's a case study. A 67-year-old male retired airline pilot who presents with difficulty breathing, fatigue, abdominal pain, and numerous hardened black lumps on his left arm. His relevant medical history includes hypertension, well-controlled hypertension, and osteoarthritis. Cancer Therapy Advisor is the site I used. Okay. Myths, facts, story of courage. Myth number 1. Most people might think about melanoma only showing through large, weird-looking spots, but they can also be small and less noticeable. Myth number 2. If I avoid the sun, I'll be fine. That's not true, you libd. You can still get melanoma from an inherited gene. Myth number 3. It's just skin cancer. I'll be okay. No, melanoma is actually the most deadly type of skin cancer. Myth number 4. People with dark skin don't get skin cancer. No, I mean, while it's more common in lighter skinned people, the death rates are actually higher in dark skinned people. So it's like, either way, like there's trade-offs and stuff. Myth number 5, a base tan will keep me from burning. Yes, tanning is the skin's way of repairing and like protecting you from getting burned, but it doesn't actually prevent you from getting skin cancer or melanoma. And then here's a quote from Jamie Troyle Goldfarb. I am not a religious person, but the best equation I can make to waiting for scan results is sitting in purgatory, waiting for someone to decree if you'll be going to heaven or hell. It is like that every single time. It's not a routine medical exam, it's not a necessary hassle. It is the time when you are waiting to find out if you get to keep living or if you may be one step closer to death. Even if you aren't in active treatment, even if every previous scan has showed favorable results, each time you wait, you are reminded that at any point your life could drastically change, and that is the reality of surviving stage IV melanoma. Quote, Jamie Troyle Goldfarb. This is the link to that story. Okay, bibliography. .org, .com, and .net are the types of sites that I used for my research. These are the sites that I used: Melanoma Research Alliance.org, CancerTherapyAdvisor.com, ResearchGate.net, American Childhood Cancer Organization.org, the American Melanoma Foundation.org, and CBI.org. Oh wait, it's missing something. .org, .com, and Okay, so we're just gonna skip over this because I already showed this and I forgot about it. Doesn't NCBI sound like NCIS or something? It sounded familiar when I first heard it. Oh, also, wait, what? I forgot I'm still recording. Okay, end it. People are most susceptible. How do you say that? Susceptible. Disorder occurs in the CDK2NA. What? Wait, it occurs in the what? Okay. What does that mean? The last time melanoma research was approved by the Cancer.net editorial board was in the last what? Mrs. Lavadia, I think there's a typo in the format.